Good afternoon. Thank you for coming to this session. When we put the program together, we realized, of course, that the importance of the financial crisis and the potential impact on a number of industries, if not all industries, would be a major topic of discussion in this annual meeting. So the way we work, for those of you who don't know, each industry sector have their own what we call governors meeting, which is where the CEOs and principals of those industry get together and review their agenda, their issues, and discuss the most important items from their perspective. And so what we decided is that we would have 3 sessions for distributing the industries in 3 sessions to get back to the general audience the results of those discussions in each industry sector in terms of how they view the impact of the crisis on their specific industry, but also give you a feeling about what each industry sector is working on, what their insights are, and how they see some of the threats and opportunities that exist in their particular sector. So we're very pleased that we have a wonderful panel here. We have the 3 industries that are represented here are healthcare, consumer industries, and information technology and telecommunications. So the way it's going to work is that I will introduce the panel and ask each of them to give a 3, 4, 5 minutes report on the topics I identified, and then we'll open for questions because I want to make sure this is interactive and you have a chance to participate in discussion and ask your questions. My name is Jean-Pierre Rosso. I chair the Center for Global Industries at the Forum, which is the organization that covers all the relationships between the Forum and the private sector. And we are organized in 17 sectors, and as I said, we have those 3 industries represented here today. So if I start on my left here, I have George Halvorson, who is the chairman and CEO of Kaiser Permanente, a major healthcare company. Next to him, we have Mark Parker, who is the CEO of Nike. To my left here is Ken Powell, who is the chairman and CEO of General Mills. And then we have the technology people on my right here with Azim Premji, who is the chairman of Wipro, and Solomon Trujillo, who is the CEO of Telstra Corporation. So since I started this way, I'm going to start this side, and ask Solomon to kick off this report.
Okay, Jean-Pierre. We've had a very interesting dialogue during this past week. It all started with some of the same, what I would call pessimism about the financial overview that have been given by many, and my intent is not to repeat that. But we quickly turned our discussions during the week to a more positive tone. And the positive tone is that the information, communications, technology sectors have always been part of catalyzing change. They've been part of helping stimulate growth and not getting caught up in the issues of slowing growth, although most companies in our sector are being affected to some extent with lower sales growth, lower volumes, and maybe some being affected even at the bottom line in terms of their margins. There's been some slowdown relative to capital investing. But what I think most of us in our sessions got to talking about was, how do we catalyze growth? How do we start dealing with the issues that are at hand? Because in most economies, we tend to touch about every business and about every consumer in one way or another. So we talked about finding ways to stimulate investment, leveraging innovation in terms of what we do as businesses every day. And we talked about how we as an industry, in particular, whether it be the communications, the software industries, the hardware industries, or those who create some of the integration, like those of Azim at Wipro and others, how do we start collaborating even harder about creating new value-based solutions that allow for growth? So what's an example? An example might be looking over on the left at Kaiser Permanente and talking about healthcare. There's a lot of issues that have to be dealt with in healthcare. There's lots of costs, and people talk about percentage of GDP. Well, there's a lot of ways to reduce the cost to deliver. There's lots of ways to increase access. And you do that in many ways by leveraging bandwidth, deploying bandwidth across nations, across cities, across environments, and driving applications and services that many companies have already developed that allow for in-home healthcare versus in hospitals, that allow for reduction in investment in multiple locations versus single. And there's many other examples in education, in retailing, in banking, and commerce in many different ways. So we spent most of our time focusing on ways to collaborate, ways to grow, ways to affect productivity. Because most of our economies around the world, whether you're in a developed, as described, developed economies or developing, most of the growth came in the 90s and the first part of this decade tied to productivity. And I can't emphasize enough how important that is, and for all of us to find ways to stimulate that. A couple last quick thoughts. As we talked about what was happening in the environment, there was a consensus around a pervasive view that says we need more regulation. And obviously many people start bristling at that notion that says more regulation is a good thing. I think what we've seen across all sectors is that there has been some erosion of trust in companies, trust in leadership, and other issues. And therefore, a quick solution is always to regulate more. And the answer, when you think about innovation, is not to regulate more, but it's to center where you regulate, where it can add value, it can add productive benefit, as opposed to becoming more bureaucratic, disincenting investment, and constraining what opportunities are out there. The final thought, before I turn it over to Azim, who is part of our team here, is that at the end of the day, everything is about the consumer. The consumer in the home, the consumer in the business, the consumer wherever they might be. And as we're starting to see the substitution of technologies, in the US, we have a president that won't give up his BlackBerry. Why? Because he has found that cycle time to decision-making, cycle time to communications, and the cycle time of keeping, in his mind, a nation moving is really important. I use that as an example because all of us can leverage that. That's what our industry brings to bear in terms of new paradigms, new shifts, new ways of delivering. And so as follow-up, we will be focusing on ways that the media industry, the technology industries, software industries, everybody will start working on more rapid introduction of technologies and finding ways to incent even more investment. Azim?
Thank you, sir. Just a continuation of what Sol was covering. I just covered three subject matters quickly. One is, the general conclusion that the technology, all technology, but particularly IT technology, is becoming more and more agnostic to language and culture. And that's an important trend, and one finds it in many homes in terms of what people from different communities use technology to induct their children into the community do's and don'ts. particularly in countries like America, which has really got so many different countries which are represented there. The second is a very important trend, which I think a lot of people are not realizing, is in this slowdown of the last year, the current year, and probably going into next year, the devastation it is causing on job losses and the human devastation it is causing on job losses. It is there in Western nations, but in many Western nations, there are air covers of unemployment insurances and much larger quantum of savings. But if you see the devastation it's going to cause and social unrest is going to cause in emerging countries such as India and China, where information technology has been a significant contribution to job creation. As an example, if you take direct employment and indirect employment of the IT industry, IT and the BPO industry in India last year, 2008, the direct employment was additional add of about 600,000 people, professionals, software and BPO professionals, extremely well trained, well educated. And the surround effect of that in terms of the jobs we created as a surround, and there's enough research on this to establish it, was 2.4 million, 4 jobs for every job we created. So we net added to 3 million jobs last year out of the total add of 10 million jobs in the country. If this industry slows down to growth rates of 0 or little over 0, suddenly those 2.5 or 3 million job creation disappears from the market. China, because of the IT industry, particularly in electronics hardware, would have added close to about direct and indirect about 4 million jobs last year. Those have become negative this year. And already just in terms of the vacation of people from Shanghai and from Beijing in the electronics industry, the figures are absolutely staggering. That's one important implication of what the slowdown is going to do in terms of job creation. The third one is vis-a-vis the global sensitivity, the community sensitivity, and now the government sensitivity in trying to seriously drive eco-sustainability, eco-energy, conservation, carbon footprints, etc. There are various things various companies do at an individual company level in terms of how to reduce energy conservation, and all of us do it in one form or the other, and the results are very quick paybacks for that. And many companies now are starting investing in eco-sustainability at investment threshold rates, which are significantly less than what they would be using for conventional investment. One is because of social responsibility. 2 is because of impending government pressures building up and change policies building up. And 3 is taking a more long-term view in terms of what energy prices are going to be. But the IT and the telecom industry in particular will see huge opportunities coming up for creating businesses as integrators in the area of energy uplifting and energy sustainability and bringing systems integration skills into it. And we think that it is important that like we have champions at other forums, this industry also builds at least one champion who's able to present an industry point of view to the community and to governments in terms of what we should be doing. Thank you.
Thanks a lot, Azim. Let's go to Ken again from Consumer Industries now.
Okay. Well, thank you. Thank you, Jean-Pierre. So I represent the Consumer Industries Council, and we're a nice group that's growing. We added a number of new members this week, I think including Carrefour over there, and we're very happy about that. And we're a collection of food companies, other fast-moving consumer goods, retailers, other household products, other consumer products like Nike. And I would say that in general, our industry, while there's certainly many different stories, are somewhat insulated from the current crisis. I mean, just as an example, the S&P 500 was down a little over 40% last year in the United States, and our industry sort of peer set was down less than half that. So we are, in general, composed of a group of companies that tend to be resilient, tend to be the opposite of cyclical, tend to do pretty well through crises, and this time around, for the most part, is no exception because our products are every day. I mean, clearly, consumers are buying breakfast cereals and soups and snacks and yogurt and these sorts of products every day, and we see that continuing. We are seeing some very interesting changes in consumer behavior as we plunge deeper into the recession. I think the most profound of which, certainly in the United States, and I think to a lesser extent, but similarly in Western Europe, we've seen over the last 35 years rapid growth in food consumption away from the house, especially in the United States. So if you go back 2-3 years ago, of the $1 trillion a year spent on food in the U.S., about half of that is being spent in restaurants and fast food and basically away from the home. But what we see now over the last year and a half is a very, very significant change in the direction of that trend. Basically, consumers in North America rediscovering the grocery store and cooking at home again. And so clearly to the benefit of some and the disbenefit of others, as many restaurants really struggling in the U.S. right now. Our group has had some terrific collaboration over the last several years. We work together on water security, which I think Mark is going to comment on in a second, food security, sustainability, health and wellness, particularly in the workplace. And so we're used to collaborating. We had some very good sessions this year on this week on food security. A quite disturbing one, really, with the World Food Program and Josette Sheeran, who reaches out very strongly to the food industry and says, "I need your help. I'm feeding hundreds of millions of people. I don't have enough nutritionists. I don't have enough food scientists. We know we can do this better, and we know you can help us." And that was a very productive meeting, and I think that we'll see our industry step forward. There's a lot we can do, and we're eager to do it. Then on a more positive vein, there was a very good gathering of many from our industry exploring sustainable business models, sort of at the bottom of the pyramid, if you will, but how can we get more engaged in a number of emerging countries around the world. I think the last comment I would want to make is again, on regulation. And clearly with the food safety issues and headlines, this is an industry. I don't know that we need more regulation, but clearly we need more regulatory capacity. We argued strongly for this in a number of sessions. The FDA, as an example, is an agency whose funding and capability has declined significantly over the last 10 years, and our industry is arguing very strongly that needs to be reversed. We need much stronger regulatory capacity in the U.S., and we have other major food-producing countries around the world that lack centralized food safety authority. So this was another point that we discussed.
Thanks a lot, Ken. Mark, continue on the consumer industries sector.
Yeah, we had a very productive set of meetings within the consumer sector, focusing on issues like water, food, health and well-being, and then sustainability, as Ken just mentioned, from a production and a consumption standpoint. Great meetings. I was actually very pleased to see that those issues weren't overshadowed by all the discussion on the current financial crisis. Obviously, that was a fairly all-consuming topic here at Davos over the past week. But in our session, we actually focused quite a bit on the issues that were identified last year as being very important, critical issues in the longer term, particularly around the area of sustainability. So we powered through and I think took the road toward how can we move forward from an opportunity standpoint and really attack some of the things that we're going to be challenged with regardless moving forward within and then certainly coming through the current financial crisis. So that was very good to see. Some great discussion, some lively discussion, many of the sessions. I think clearly I don't want to dismiss the financial crisis, but I will say, obviously many companies will obviously have to go through their cost cutting and restructuring and right sizing, and in some cases just flat out survival. But I think the important thing is that we stay focused on these critical issues that particularly again around the area of sustainability going forward. So that's again where we spent most of our time. Some of the comments I'll make are reflective too of those that have already been made. These are obviously extraordinary times for all industries. Currently, I think, and this was one of the comments right up front, is those companies that really stay focused on the consumer, that have the consumer front and center, certainly in the consumer industry section, but I think all through these industry groups. Those that have strong brands that are relevant, connected well to their consumers, engaging, those are the companies that I think will be well positioned moving through and coming out of this crisis. And, those are the ones I think will continue to sustain success going forward. The other comments here would be that I think, the one thing that came out loud and clear for me in the sessions I was attending, the discussions I was involved with, the clear consensus that one of the most important issues that we need to deal with going forward is that of sustainability. So I do want to talk about that a little bit more. Sustainability is one of those issues that's sort of moved from the periphery into the core. And I think those companies that really understand how central that issue is to their business structure, their business models, their financial models, and how they integrate that into their success going forward will be the companies that are better positioned to continue to be successful. This is not a financial, or I should say it is a financial imperative. Obviously, we're dealing in a world with dwindling natural resources, populations on the rise, prices on some of the input items that we've kind of taken for granted, now being more critical in terms of our success going forward. So business models will need to change, and I think, in fact, they are. Very encouraged to see the level of activism amongst the companies and brands involved with these discussions. I must admit, too, from the where we were last year in these discussions to where we are this year, a marked difference in the level of energy and engagement. One of the words that came up time and time again was collaboration. And that can be one of those overused words, but I think sincerely a lot of interest in how do we better connect across companies, across industries, within the public and private sector to truly collaborate against some of those biggest issues that will really drive, I think, not only our success in terms of individual companies, but I think, again, as a planet here, and certainly the global economy. Some of the feedback from the consumer industry governors sessions, specifically, we must continue to evolve our models to more closed-loop models, including lower carbon footprint, lower water usage, creating more value out of the products that reduce the use of natural resources. That's critical. We must move faster to scale and reduce costs out of products that reduce, or that to reduce costs, we must collaborate in new ways, break away from the, I think, fragmentation, from the incrementalism, to take bigger strides, to work more effectively against, like I said, across companies, across industries, with government, businesses, NGOs, I think, to work together to solve some of these bigger problems. And that will require, unquestionably, some new forms of cooperation, new approaches to how we share information, innovation, and best practices. So there's a lot of good discussion on that in the sessions, and also some good thoughts of how do we progress from where we are today to that of next year. Some of the discussions that will take place during the course of this next year to the session that we'll have next year as well. This requires a roadmap, I think, that we can all coordinate on. Obviously, the world is an interdependent place, and our ability to leverage that interdependence, I think, will be a real strength. I mean, it's a necessity, in fact. So this is no longer a CSR or philanthropy issue. It's really about core business strategy. And I was really encouraged to see that come out loud and clear, sincerely in all the sessions that I attended. As one fellow CEO on the Consumer Industries Group said, I can't imagine doing business without sustainability. It is not an option. Sustainability is key to our financial success in the future. And again, I think that's shared across our industry group, and I'm sure outside of this group. So over the next year, there's a call to create, I think, more of a common language to better understand, define, and attack sustainability. It's one of those big, broad, macro kind of words that covers a lot of ground. So how do we break that down and make it actionable? Create measurable metrics and targets, prioritize and create traction against the shorter list of opportunities that will create the greatest impact. So there was some good discussion on that yesterday in a very lively session called The Power of Competitive Collaboration. So really encouraged with that. More work needs to be done on focusing on the governing, pricing, and tracking dimensions of sustainability going forward. Needless to say, work on how we develop greater transparency, engagement with key stakeholders. And again, there was more recognition that there's been an explosion, I think, of interest, scale, and velocity on this topic over the last 12 months, and a lot of optimism that will continue through this next year, despite the fact that we're facing some greater financial challenges across the board. In fact, the theme of last year's meeting, the power of collaborative innovation, was really seen to contain many of the real solutions to the theme of this year's meeting, shaping the post-crisis world. So I think, again, I came out very encouraged with the discussions, the commitment, and this interest in really collaborating more deeply and in new ways to get after some of these bigger issues. In fact, there was some call amongst many of the meetings to actually get the various industry groups together and start to cross-collaborate again on some of these issues. So that's a good opportunity that we will take advantage of as well.
Thanks a lot, Mark. George?
The healthcare governors had several very good meetings. And what we concluded in the course of our discussions was that healthcare does not need a bailout. No aspect of healthcare is in trouble or impaired. What we have is a concern that some of the government programs are likely to be underfunded in a number of countries because of the significant budget crunches that are going to be facing every area of the economy. But the industry, as an industry, it's a little bit like food. Everybody needs to eat, and the food industry tends to survive through any kind of an economic downturn. The healthcare industry is somewhat similar. People get sick and will need care, and those patterns of usage will continue. The challenge for us wasn't so much in the generic economic downturn. The challenge is the relationship between healthcare costs and the downturn. And the concern is that where healthcare costs have been going up faster than spending in other areas of most economies for a number of years, and people have complained about it, they've complained about it in the context of everybody's economic situation improving. And now when other economic situations are deteriorating, people have less money, people don't have jobs, employers have less money to work with, we're facing a situation where there's a potential across multiple countries for a backlash relative to cost. There's a backlash that could find itself impacting the industry very directly in a number of ways, and it could impact the industry in regulatory ways. It could impact industry relative to price setting. There's even some challenges going on right now relative to the business model of intellectual property for pharmaceuticals. There's a whole series of places where if people become excited and angry enough about healthcare costs in a time when the general economy is in a mild crisis, the negative impact of that on the industry could be significant, and it could be significant relatively quickly. And so the challenge then, and this again is a collaborative thought process, the challenge then is to change the trajectory of healthcare costs. And how can that be done? Well, there's a consensus among the governors that we need to look at the database of healthcare and all recognize the fact that in every country, developed countries and the less developed countries, chronic conditions are the #1 driver of healthcare costs. It's overwhelming in the U.S. 75% of all healthcare costs come from people with chronic conditions, 80% of those costs from people with comorbidities. The same sorts of ratios are true in the developing countries. We had an excellent report on India. We had an excellent report on China. The majority of costs and the majority of deaths already are coming from chronic conditions, and those are growing. And across the planet, we do a really weak job of taking care of people with chronic conditions. We don't do a good job of intercepting those diseases early. We don't do a good job of preventing those diseases. And we don't do a good job of treating them once people have those diseases. And we looked at data from the U.S. where only 8% of diabetics end up getting appropriate care, even though diabetes drives 32% of the cost of Medicare. And we looked at leakage from appropriate care delivery in India, where only 6% of the people who are diagnosed with diabetes are still getting appropriate care at the end of the diagnosis, treatment, prescribing, care delivery model. And so we've got a situation in country after country where we're not doing a good job on chronic conditions. That's where most of the costs are, and that's where the opportunity is. And so we talked about having collaborative approaches across all aspects of the industry to focus on those conditions. And as we talked about that, we also talked about the next major development in healthcare is going to be the introduction of computers to healthcare as a care delivery support tool. Talking about connectivity. Right now, healthcare is almost entirely data-free in just about every country. People don't do a good job of tracking disease, don't do a good job of tracking caregiver performance. People don't know what the relative outcomes are likely to be for various treatment modalities. The science of healthcare is almost entirely data-free, partly because almost all healthcare data is still recorded on paper. It's in individual files. It's not interconnected. There's no good science. There's no good follow-up. And there's a massive lack of connectivity. Caregivers are not connected with each other. Caregivers are not connected with the patient. And so there's a whole era of connectivity that healthcare has just missed. And everything else is connected, and healthcare is unconnected. And so what we're talking about are the opportunities that exist. If we can connect the data about each patient to the caregiver, we can connect the caregiver to the patient, there's opportunities. The best pilot programs that have truly connected the caregivers with the patients for chronic disease have cut the number of kidney failures in half, cut the number of people going blind in half. The opportunities for better care are huge, but we need a different toolkit and a different paradigm about care delivery to get to those kinds of outcomes. And we talked about the fact that across the planet, in every country, there are agendas going forward to try to computerize parts of that database and to try to computerize pieces of that equipment. And we talked about the fact that it would be silly for us to go forward and build all of those different computer capabilities in silos, when what we really need is patient-focused connectivity in the data flow. So we talked a little bit about plug-and-play sorts of interchanges between diagnostic equipment and medical records, between various levels of patient information and medical information, and talked about the fact that there needs to be a world agenda that focuses on all of the information about all of the patients all of the time available to the caregiver, real-time data flow about the patient and real-time data flow about the disease. And that's all within the capability of the computer technology we have today. And none of that is being done in healthcare consistently anywhere. So the opportunities are huge. The opportunities in healthcare to do this job much, much better are massive. And we as a group talked in very collaborative and supportive ways about doing that, and talked about what the forum can do to help project and support that agenda. The forum has done a very good job in the past focusing on infectious diseases. Infectious diseases have gotten most of the publicity, and there have been some major needs and some major opportunities relative to some infectious disease, and so that work has been excellent work. Now we need to connect that work with the chronic conditions where the real dollars are and the real opportunities are, and where there's some real low-hanging fruit relative to very poor care, and connect all of that to a sense that we need a world agenda for interconnectivity and plug-and-play sorts of technology in healthcare. So if we move in those directions, there's an opportunity to do a lot of good. And there's a sense on the part of the governors that the forum has a very nice platform for bringing people together to at least start some of those agendas and bring them out. Because everything else, again, in the world of health policy is very siloed. Governments talk to themselves. If you think about the various places, most of the health organizations that are international are single disease focused. There's all kinds of opportunities, or focused on a subset of support, and what we can bring together here is a combination of people from the government, from technology, from healthcare providers, and talk about those agendas. So we had a very good series of meetings, in a sense that we really now need to focus as an industry and get into a mode of continuous improvement.
Thank you very much, George. I think that, the first reaction I have is that when you talk to great business leaders like the ones we have here, they understand the situation, but they look forward. They look for opportunities. And that's a striking difference with some other groups of people, which will go unnamed, about the doom and gloom that's always upon us. I want to open up at this point to the dialogue with the audience. So we'd be delighted to take your questions. You can address them. You tell us who you are and what your question is, and whether you want to address it to a particular panel person or to the whole panel.
Actually, to the panel, it's delightful to be with a set of industries that, of course, are sessions in some extent. So it's a pleasure to be here after 4 days. Not working.
Yeah. Could you get the mic to work, please?
Sorry, just Shamit Banerjee at Booz & Company. The question is to the panel really in the sectors. We have persistent work over many years that shows that, in fact, variation in performance within an industry of companies greatly exceeds variations in performance across industries. So said differently, good companies in bad industries perform better than bad companies in good industries, if you see what I mean. And of course, recessions exaggerate these differences within industry. The transversal feature that we see across all industries is the pressure on liquidity and credit. And I wonder if, whilst there are big differences across industries, whether in your conversations there was some discussion about the impact of pressure on cash, liquidity and credit generally, on the ability for industries to undertake the restructuring that does need to happen in many of these, of course, because without some access to liquidity and credit to make the sorts of changes happen, what will happen is industries through unemployment and so forth will lose capability, which is not good for anyone.
Access to credit.
Yeah, the questions of liquidity and credit and their impact on industry performance.
Saul, you want to take a crack at that?
Well, we actually had some conversation about it in one of our sessions, simply because liquidity is a big deal, access to capital, because many of us are big infrastructure builders, and we spend billions of dollars each year. And so part of the collaboration that's required here is perhaps some better differentiation in terms of those who are capable of generating cash to repay so that they can, in fact, get access to more capital. You know, it's the positive cycle view versus the negative cycle view. But the other part of our conversation was that and I think you're touching on this, is that the better run companies generally have spent time conserving capital. And cash, you know, those of us that went to business school over the years, we always learned about cash is king or queen. And the issue is those companies in most industries, regardless of whichever ones they are, they're the ones that now have the opportunities to accelerate. They're the ones that have the opportunities to consolidate. They're the ones that have the opportunities to gain even more market share, so to speak, as we go forward. But it is a very important issue, because on the other side of it is smaller companies, startup companies, innovative companies. They don't have that cash generation capabilities yet. So the part of the question for us within the ICT group was, how do we help them? How do we find ways to do business with them? How do we find ways to perhaps invest in them and continue some of the venture investing that has been done, in particular in the last probably decade and a half? So it's an important question. It's a tough issue. And unfortunately, it tends to be those who are strongest and best have the best opportunities to overcome, and those who are weak either disappear or get consolidated.
Anybody else wants to make a comment? No, I think that's a pretty good answer. I think that you do see in many industries, not necessarily represented here, but the auto industry, for example, has had to support their suppliers because the suppliers just didn't have access to capital. So that happens in several industries as well. Any other question? Yes, over there. Hey.
Hi.
How are you? Good.
Very good, thank you. Stefano Versa from Alex Partners. Related to availability of cash, and good companies certainly need to conserve cash, particularly in this period. What has been, or you see the impact in terms of innovation, product development? Are you cutting programs, delay programs significantly, or do you see that happening?
Yeah, I'll jump in on that. I think it's critical during these times that the R&D department, so to speak, the commitment to real innovation doesn't get shortcut. I think there's obviously opportunity with every company to make sure that you're editing your innovation list, that your R&D is focused on the shorter list, again, of things that are most critical. R&D in many companies over time, particularly when times are good, tends to grow and pick on lots of projects that maybe are nice to have but not really that core and critical. So it's good to really sit down and focus on, are we really editing the list down to what really matters, like every aspect of the business, every dimension of your business. But I tend to think that these times, where we're all challenged more financially and otherwise, that these are the times that where you see thrusts and creativity, you see intellectual and creative horsepower kind of coming together at a different level, and in many cases, real breakthroughs coming. So that combined with the appetite, and I really think it's a great, for me, it's a bit of a revelation coming here this year, the appetite for collaboration outside of your own company, and to get together with other companies and other industries to really attack some of these big, R&D or innovation-related opportunities is incredibly encouraging. So I think the open source modeling, some of the more collaborative new models of innovation, and again, the receptivity to really focusing on R&D outside of your own company with others is going to be, again, that's a source of great optimism for me.
Jean-Pierre, I'll pick it up where Mark left off. I'm very embarrassed to say that you go back 10 or 12 years when we would receive an idea from someone outside of our company. We used to send those letters to our lawyers, who then, I don't know what they did with them. They threw them away. But, those days are past. clearly, we're continuing to invest in R&D and to increase that investment annually, and we'll do that again this year. But what has changed is it's become a much more collaborative process, much more externally oriented process, and this is the only way that we can get the R&D productivity that we need in order to compete. It's as the head of our innovation and technology group likes to say. I mean, the typical scientist at General Mills used to say, the lab is my world, and we've turned it on the head now, and we're trying to, the new mindset look is the world is your lab, and go out and connect. There are 2 million scientists outside the walls of General Mills. There are lots and lots and lots of ideas. The thing you need to solve the problem you're working on has probably already been invented. But we have to build those connections around the world in order to attain that kind of productivity. The other thing that's changed is the things that we're working on within our labs. Clearly, the consumer is very, very oriented towards health and wellness. Now, we've already heard that from everyone on the panel, and so our challenge is things have to taste good. It's only nutritious if you eat it, but there's too much fat. It's too much sugar, too much salt. We have to find ways to reduce this. And on the other hand, there are things that we need to add, micronutrients and fiber and whole grain, these sorts of things. And, so increasingly that agenda is very much at the center of what we do in our research centers.
Yeah, if I could just add one quick last comment on that, too. There was a great quote here a couple of years ago in one of the sessions. It was that there's a lot of smart people in the world, and most of them don't work for me. And that was really just talking about the idea of reaching out into more of an open sourcing opportunity in this digitally connected world and taking advantage of that.
Yeah, George.
Quick comment relative to healthcare. R&D, we are slowing on projects like building new hospitals, building new clinics. We're slowing some of that capital spend a bit. But in the area of healthcare where we're dealing with the information about patients, we're actually continuing those projects because we think the R&D results are going to be very directional and very guiding for what the next stages of healthcare are going to be. So we've invested enough. We've put about $4 billion into computerizing all the medical records and all of our patients. We're now expanding, and on 500,000 patients, we're going to collect the DNA database. And then we're going to work backward from the DNA database to figure out what kinds of correlations exist that we didn't know about before, so that we can identify how we can intervene in the progression of disease earlier, help figure out which drugs work better for which patients. And we really think that care is going to get a lot better using the science, and this is exactly the wrong time to back off the investments in healthcare R&D.
Jean-Pierre, just one more thought. I think the example on healthcare is a perfect one that highlights a discussion point in our sessions, and that is that innovation is not just about products. It's not just about services. It's really about how you operate your ecosystem. And so innovation gets broken apart in lots of different ways. And so scarcity tends to be a driver of that innovation. And so sometimes periods like this tend to be, some of the greatest periods for innovation through an ecosystem and a delivery of capabilities.
Yeah. The power of...
Can I just add something?
Of course, Azim, I'm sorry.
Just to supplement what some of my colleagues have been saying, quite obviously in a situation of compressed markets and compressed pricing, companies have to differentiate much more. But I don't think that necessarily will result in much increased R&D budgets. What I think it will result in is much more output from R&D budgets through measurability, through accountability, and through prioritization. I also think that you will see a significant amount of innovation coming in business models because of restructure and reset. And the companies which will really stand out will be how those are differentiating in fairly lateral business models, which are not conventional and which can really differentiate in the marketplace.
Yeah, those are really very good points. Just to add to what some of you have said, I know several companies that have gone as far as putting part or all of their patent portfolio on the internet keeping some protection, but accessing scientists around the world saying, look, if you can do something with this patent, which we haven't been able to exploit, tell us. So suddenly you have opened up, through this technology and access to unbelievable intellectual capital. So the world is changing rapidly, and technology is making a big difference. Any other question on the floor? Yes, please. Mike? See, we want to hear you.
Yeah, okay, thank you. Olaf Gersemann, I'm a business editor at Die Welt, a German newspaper. I would like to ask a very simple question to the whole group, because I think only Mr. Trujillo so far has touched upon it. As for the perception of the economic crisis and the immediate economic outlook for the whole world economy, have you become more pessimistic or optimistic over the last couple of days here in Davos?
Okay, we start over there. George, more pessimistic or more optimistic?
That's a very good question. That's a good question. I think more optimistic.
Good.
I think I'm feeling more optimistic based on the conversations I've had, and certainly based on the healthcare governor's interactions.
Mark?
Yeah, I must admit I'm an unrepentant optimist, so it was hard for me to have that chipped away here, although there were some challenges, I think, during the week. But I'm coming out more optimistic, particularly on the subjects that I was talking about, this notion of collaboration and, this realization of interdependence and how we need to work together to get to a better place. So more optimistic.
Okay. Well, I am unrepentantly consistent. I came here not very sure how it was going to play out, and I'm going to leave here not very sure how it's going to play out.
Yeah, I heard this morning the financial people say, a good thing is that now we admit we don't know because we don't know. So that's progress. Azim?
What I came out here with very clear conviction on is how much global support the new leadership of the United States has. And I'm a very strong believer that a lot of turnarounds are also a function of sentiment. And if sentiments rise, a lot of consumer behavior starts changing. And the reason I'm optimistic is I think you will see the confidence in the new leadership, the enthusiasm, and the emotive connect with the new leadership across the world, whether it is in Asia, whether it is in India, whether it's in the Middle East, adding a lot of turbocharge to a possible turnaround a little earlier than what one would have anticipated before coming here.
I guess my perspective is that I'm obviously an optimist. I love going and differentiating both in good times and bad times. But in terms of the discussions here at the beginning of the week, I think they were fairly negative. They were almost depressing for a while. But now towards the end of the week, as you've heard from, I think, each of the governor's sessions, people have been spending time talking about, okay, how do we deal with what we're talking about, as opposed to just describing what's happened. And I think that is part of leadership, and I'm encouraged to see that across sectors and even from some of the political leaders, including the financial community.
Very good. Questions? Yes, here, there. Sorry, the lights up here.
Hi, my name is Jeff Yang with Red Point Ventures, and I'm interested. Mr. Powell talked a little bit about some of the changing behaviors in this economy, about people eating in more than eating out. I'm just curious, across the board, are there any themes in each of your different industries about how things are different this time, either with consumer behavior or corporate behavior?
Sure.
Okay, I'll start. Within what I would call the communications environment, people using broadband, using their wireless devices, I'd ask all of you, when you walk out of the room, just observe how many people are checking their BlackBerry or their iPhone or some other smart device. There is a big change because we found that, again, it's a tool. You spend more money on it than probably anything you've ever used before, but you find it as a value that's been delivered. If you look at the internet, in the case of wireless now, we're moving to 4 billion people having wireless devices, to 5 to 6 over the next few years. In the case of the internet, we've all become webified, which is a difference, and we're not seeing people unhook their internet, because some of us, when we went to school, we used to think about going to the library. Well, today's library is the internet, and you're not going to take that away from your children, or in the case that many of us do our work, our business, and actually get entertained sometimes through these sources of websites and other things. So I would say in the case of our industry, we might see less of traditional things, perhaps voice calling and things like that, but we're actually seeing more people browsing, more people communicating on different kinds of platforms and doing it in basically different ways. One last thing. I keep on looking over at healthcare and education and a lot of other sectors. What we're really seeing is a lot of substitution occurring as well. People are accelerating some investments in order to change the paradigm, because in some cases there aren't enough nurses, there aren't enough doctors, there aren't enough caregivers. So you have to find those substitutions. And for us in our industry, that's pretty exciting, and it's pretty compelling, because it really means a lot, both societally and also to the bottom line.
Mark, any consumer behavior changes in your...
Well, I guess I would just state what might be one of the more obvious, and that is consumers are just much more selective, and I think spending more time editing their choices, focusing on the fewer things that really matter the most. Obviously, movement away from luxury-type products for the time being, not seen as seen as being more conspicuous consumption, which I think is in many places I would say even frowned upon. But just the more selective editing in terms of what people are choosing to spend what disposable income they have on. Yeah, I mean, that's what I...
So do people buy their sneakers more online or in stores?
Well, we are seeing a bit of a rise in online sales.
Right.
Yeah, I think people, it's a way to conserve gas, fuel. You don't have to get out and travel quite as much. Online, purchasing is a lot easier these days. Certainly with the younger generation, it's a much more natural process. So we've seen actually an increase, a fairly dramatic increase in online sales. Yeah.
Okay. George, you want to...
Yeah, I think the Internet's going to transform, Internet and that level of connectivity is going to transform care delivery in the developing world hugely. Because the models of reform that most people were talking about for third world countries were models of replicating Western infrastructure and dropping clinics and hospitals and all of those sorts of buildings, sites and places into third world countries. And there isn't enough capital to do that, and there aren't enough workers to do that. But if you substitute dropping infrastructure in and replace that with dropping knowledge in, and you have first aid workers that are well connected with higher levels of caregiving, and nurses and family practitioners, and work that back upstream in a hub and spoke sort of system, you can really transform care, get much better care out into the hinterlands at much less expense. And the only reason that's possible is because of the computer connectivity, the ability to do things like basically televisits, sending photos back of what a wound looks like, those types of things. And there are some very good pilots going on, and I think it will be transformational. It will make better health care affordable in different parts of the world in ways that have never been done before. There are parts of India, parts of Africa, parts of China where we're never going to go out and be able to build, not certainly for a very long time, build bricks and mortar infrastructure, but care delivery of a very high quality can be actually dropped into those places through a level of connectivity. And so I think there are a lot of innovation, and a lot of it's going to be substitution. And you're right, there's a limited number of nurses, but we can train more first aid workers supported by nurses, and then triage that process to make sure the ones who actually need the nurse get there. That's a far, far more efficient system than putting people into either jeeps or hospital sites. So I think it's going to be very transformational, redefine care delivery, and open up some opportunities for the world that haven't been there before.
I think one other thing just to emphasize, and I think this is new. It's new for those of us that have lived, worked in what we label as the developed economies. You can go to India, you can go to China, you can go to Nigeria, you can go to all kinds of places where innovation is happening. And in some cases, we need to replicate what's happening in those countries in places like the US or parts of Europe or other developed markets.
Thank you very much. What time for one question, and quick answers then. Make it simple.
It's very, very simple. Hi, my name is Jillian Manis. You talked a bit about training in terms of training in healthcare, and that's something that it seems I'm hearing a lot about, which is we have all this innovation, we have opportunity, but what are you doing in terms of retraining and educating our workforces that seem to be rather unprepared for this monumental shift in terms of sustainability in other sectors?
Well, that's a great question, which requires a quick answer, though. But
Well, I'll just give you a quick answer from our technology perspective. I went to a company, Telstra, which is like AT&T in the U.S. or France Telecom, and we're doing a transformation, and we're basically moving from what I would call the old analog circuit switch kind of world into an IP world, an internet protocol kind of world. Well, we had to move our people with us. We allocated about $200 million of capital over a 5-year period of time to basically retrain our core workforce. And we have been doing that, and basically, as we have done that, we're seeing field force productivity increases that are unheard of in our industry. Over 3 years, we've increased our field force productivity by 50%. So it is important, and it is a different way, and leadership has to think differently as well.
You know, we have, as an example, doubled our training budget, and most of it is in change management.
Yeah, we are believing that the world of training is going to be changed dramatically by use of the internet, and that things like nurse training, you can take nurse aides and send them off for 2 years to a school somewhere and have them come back as a trained nurse, or you can get a nurse aide and hook them up by the internet, go through web interaction, testing, simulations, and train them in their home, in their village, and in their city, and so there's huge opportunities there. And there's also opportunities that come that are different in healthcare from dummies. The mannequins, the computerized robots that give birth and have heart attacks, those types of things are actually transforming the training for caregivers in ways that are very impressive, very effective. And I think a few years from now, people are going to look back and say, you actually trained on a live person? I can't believe you did that. How primitive. Because right now, people go through training programs. One quick thing, by the way, we do a lot of training now with mannequins, and they had to program the mannequins to not ultimately die, because some of the caregivers in training, when they actually had the mannequin die, they can now go into a total coma. But when they died, people actually had to have counseling afterwards sometimes, because it was so traumatic as a caregiver to lose even a mechanical patient. Okay. But that whole type of technology is going to be very transformational in care training.
Thanks a lot, George. I think this was great. My last words is that this crisis is transformational, and those companies who capitalize on this will emerge the winners. And obviously, all business leaders are optimists, and you've had a great sample today of great leaders on this panel. So please thank them for taking the time.